A 14-year-old boy comes to his physician with breast tenderness and enlargement. The patient is concerned that he will be bullied by his classmates for his appearance. Which of the following is the next best step from the physician? Choice A, admit the patient for surgery. Choice B, MRI of the brain. Choice C, measure serum LH-FSH. Choice D, testosterone therapy. Or choice E, reassurance. I'll wait 5 seconds and answer your question. This is the normal gynecomastia of puberty, which is normal, common, and benign. It usually resolves spontaneously in about 6 months to 2 years. So choice E, reassurance, is the correct answer. Very basic question, not much to say here. Choice A is obviously wrong. You would only consider using breast reduction surgery or whatever if you have persistent gynecomastia after puberty is over. Choice B, MRI of the brain. This is only if you are suspecting a pituitary tumor of some kind. Patient has no symptoms which would indicate that, so no bitemporal hemianopsia or anything like that. Choice C, measure serum LH-FSH. There's no signs that this patient is going through abnormal puberty or some kind of endocrine disorder, and there's no evidence of steroid abuse either. If they wanted you to suspect steroid abuse, they will usually give you like small testes, hypogonadism, or they'll tell you something like the patient is very competitive in a sport. They usually lay it on pretty thick for it. Choice D is obviously wrong. I hope none of you picked this because testosterone is generally a terrible idea in a normal 14-year-old boy, but you should know that this can actually worsen gynecomastia because if you give exogenous testosterone, then it'll get aromatized into estrogen and that will probably make gynecomastia even worse. Like I said, easy question, but sometimes these exist. Hope you found this video helpful. I'll see you in the next one.